shoulder impingement doesn't exist. The term shoulder impingement was coined by orthopedic surgeon Charles Neer in 1972. The theory was that there was a lot of people presenting with shoulder pain, and he thought that the cause was the bicep tendon being inflamed and enlarged. Why? The second tendon of your bicep goes through the bicipital groove and sits directly on your shoulder joint. And the idea was that if you have a thickened tendon or an enlarged tendon, as you move your shoulder joint, this creates friction. That friction of the tendon rubbing on the bone and the other surfaces produces pain. So the solution was simple. On the surgery table, we will shave down and remove any of that unnecessary tendon tissue. You will have no friction when moving, and then you will have no pain. Problem is though that it is 40 years later, and we know that the surgery makes no difference whatsoever to people who have shoulder impingement. And we also know that there is no correlation between having a thick bicep tendon and having pain. And thirdly, the term shoulder impingement creates fear among patients because they think that there is something mechanically wrong with their shoulder, as suggested by impingement, and therefore stretching, physiotherapy, drugs, massage, breathing, all these other alternative treatments out there will not work, and the only option is a scary surgery they don't want. So we need to throw shoulder impingement away and adopt the simple term of rotator cuff related shoulder pain. This just means the pain in your shoulder is coming from the rotator cuff region. It could be the muscle, it could be the tendon, it could be the joint, but it is very treatable and very manageable. If you want to know why these things happen to you, then check out the channel.